David Putrino is here. He studies and works with long haulers. He's the director of rehabilitation innovation at Mount Sinai Hospital in New York. David, thank you. Do the findings of this study match with what you're seeing with your patients?
Absolutely. Thanks for having me. Yes, this study actually really echoes findings from a study that we published around 4 months ago. So it's really encouraging to see replication of work that's already been done. We've been tracking around 60 distinct symptoms in this patient population. So at front of mind, we really just need to focus on helping these patients and getting awareness, spreading awareness that this is indeed a really serious problem associated with COVID.
You know, a study published yesterday described how long-term COVID can really affect just about everything in the body. In fact, one doctor said it's changed how she practices medicine. And quoting here, no matter what the patient comes in for, I now ask if they ever had COVID. It changes the possible range of diagnoses. Is this the new normal for doctors, David? How challenging is this for them to provide care?
Yeah, I think it's extremely challenging, but I think a silver lining here is that we may be looking at a real pivot in the way that we practice medicine. I think that pre-COVID, there were a lot of people showing up with non-specific symptoms, and they were concerned that they were being treated with formula medicine as opposed to being very patient-centric and symptom-centric in treatment approaches. And one of the things that physicians have to do now, as we're seeing this increase in COVID long hauler activity, is listen to what their patients are telling them. Treat each symptom in its own way as part of a larger problem. And so I really hope that this does change medicine for the better.
David Putrino, thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.